Did you know substance abuse is a major public health problem in the United States and is estimated to be a factor in 41% of highway fatality accidents? It is estimated that 275 million people used illicit drugs such as amphetamines, opioids, and cocaine in 2016. So what is substance/medication-induced psychotic disorder? Let's take a look.
Substance medication-induced psychotic disorder is characterized by hallucinations and/or delusions due to the direct effects of a substance or withdrawal of a substance. It is directly caused by the effects of drugs including alcohol, medications, and toxins. Psychotic symptoms can result from intoxication on alcohol, amphetamines, cannabis, cocaine, opioids, phencyclidine, also known as PCP, and related substances. Psychotic symptoms can also result from withdrawal from alcohol, sedatives, hypnotics, anxiolytics, and other or unknown substances. What are amphetamines? Amphetamines are sympathomimetic drugs with central nervous system stimulant and euphorant properties, whose toxic adverse effects include delirium, hypertension, seizures, and hypothermia.
How do amphetamines affect your brain? Let's take a look. Amphetamines are stimulants. What they do is increase the activity of certain neurotransmitter chemicals in the brain, such as dopamine, norepinephrine, and serotonin. Duration: 30 minutes after ingested, a few seconds after being snorted or injected. High can last from about 4 to 8 hours depending on the dose.
What are the symptoms? The short-term effects are increase of energy, euphoria, enhanced confidence and well-being, improved focus, motivation, and alertness, and weight loss. Some of the side effects are sleep disturbances, memory problems, aggression, hallucinations, paranoia, psychotic episodes, seizures, and even sudden death. Symptoms are often brief, resolving shortly after a causative drug is cleared, but psychosis is triggered by amphetamines, cocaine, or PCP, may persist for many weeks. The use of methamphetamines can lead to paranoia, persecution, delusions, and auditory or visual hallucinations. Delusions occur when a person believes something outside of what is actually going on, despite any external argument or contradiction to such belief.
How about we talk to someone who has suffered from this disorder and see how it affected him? Let's welcome John.
Hello, my name is Jonathan Cabrera. I'm here to talk about substance and medication-induced psychotic disorders with an emphasis on amphetamines, which I actually do have experience in. Amphetamines and methamphetamines. I actually went through the rehab program, and so there's a difference between inpatient and outpatient when you go to rehab. Inpatient's kind of when they take you through the detox process. So, for example, I was doing drugs for about a couple weeks, and after that, they take you to the detox place where they basically wean you off the drug slowly. After that, that's inpatient. They take away your phone. Can't really talk to anybody. Social media. You're kind of just, it's like a little prison kind of. And then after that, they take you to which is called the sober living, which a lot of people know of. That's considered outpatient. Basically, you live in a house exactly how you do. You live your regular life. You're allowed to get a job, but they just drug test you once a week. Make sure you're on the path. You're always going to AA meetings, and just basically that's what outpatient is. Obviously, there's always different things, different ways to treat different disorders and chemical dependency, especially mine, which was amphetamine. So I feel like this is perfect about this subject. I believe they gave me a drug called clonidine and clonopins to wean me off of a substance, and they're telling me that methamphetamines is actually one of the highest releasing dopamines out of all the drugs, so it's one of the hardest to wean off of as well. So, I really learned a lot about it. I mean, it is a difficult drug to get off of. I'm glad that, I'm successfully clean from that. Going back on, talking about, the induced psychotic episodes and, the withdrawals, going through amphetamines and methamphetamines, I don't know, personally, my withdrawals sucked crazy. I get super paranoid, and amphetamines is a drug that you can't eat or sleep off of. So, you go days on end eating or sleeping, your body's already not functioning properly. Paranoia starts to kick in. 3 in the morning, you start looking out the window, you hear any noise, you start wondering what's going on. You start sweating like crazy. You feel terrible. You feel like you're dying inside, and the only way to not feel like that is to do more and more and more. So it's a never-ending cycle. It gets really dangerous for people that can't handle it or don't know kind of how to handle it properly. You start doing things that you don't even remember. It's literally psychotic episodes where you do things and that you wouldn't normally do. You say things, you hurt people, it's just an ugly drug. It's just ugly things to get into, and I can vouch for it. They do induce psychotic episodes where I've done things where I don't remember. I'm not myself. So the only advice I can give to people that are going through this kind of things is just try to help yourself, try to maintain, try to not to do the drug. So the only way to, stop those psychotic episodes is to stop smoking that from going through it. I mean, honestly, when I did it, they teach you in there not to get clean or sober for yourself, but to do it for others as well. But in the end, you always got to do it for yourself, because if you don't do it for yourself, no one's gonna do it. But I know it's difficult, but hey, if I did it, other people could do it as well.
How does this affect those around you? Let's talk to some victims.
Hi, I'm Natasha.
I'm Tatiana.
And we first had to experience addiction or rehab when it came to our little brother a little bit over a year ago. Growing up, he smoked weed, and then it seemed to progress, but we didn't really know it until it got a little bit out of control. And I think that's because he went on a 3-day binge, so we were really able to tell that something was up. Mm-hmm. And we got a call from family kind of saying things were acting up. We went home, realized he was not okay, and then he needed help. And then between us and our younger siblings, we were able to convince our dad and to that he needed help. Mm-hmm. So once we were able to have that conversation and he slept off his high, as soon as he woke up, we
had a conversation with Jonathan.
Yeah.
Our brother.
And luckily he agreed. I think he knew that he needed the help, and we were really lucky that he said yes. So that moment was really exciting, but then mm-hmm. also this is something really new. Nothing had compared to it at that point because we never had anyone in our family go to rehab. So it was this new we're one of those families now that we need to get someone help. And luckily we had some resources that were able to lead us to where we were able to send them. So yeah, I think leading up to that moment, it was very we just had to think about what needed to be done. We got him to rehab, and then once we dropped them off there, I think that moment of driving away, you really just start to self-reflect and think, how did this happen, and what did I do wrong? Where did we go wrong as a family? Mm-hmm. Did we not see the signs?
They're just really good at just hiding it, as well as, being an addict, and just kind of now him going through all of that, they're just really good about hiding it. Yeah. And just not showing any emotion, and just kind of making sure that nobody is aware of the addiction, and just kind of going through it alone and not wanting anybody to know how deep the addiction is, or that they're actually going through it.
Yeah, and I think that's something you learn after, though, too, because I think during the time, it was definitely still like how did we not know? Like, was he hiding it? Did we just not see it? Like, were we too busy? And then you start to kind of put a lot of that burden on yourself, and realizing that you could have maybe been like a better sister, or you could have done things differently, and I should have been there more, is like all the feelings that kind of just went through my head, and I think yours too.
Yeah, I just definitely went through a really hard time with his addiction, or him going through the detox and the rehab and into the sober living, and just seeing him actually going through the whole process of the steps of the detox as well, and seeing his emotions go up and down, and physically seeing the drug, just how he's changing and how his body is kind of being a different person now because the drug is not inside of him.
Yeah,
it was really hard. Just like knowing, as like I feel like I failed as a sister. We just kind of didn't realize growing up of how bad it was affecting him. We lost our mom and he was 5, and we just, it might have started from there, his addiction, but we just kind of don't really know where deep-rooted it started.
Yeah, and I think that's kind of one of the things that happens when someone in your family does go through it. You start pulling out, not the blame, but you're just trying to figure out, like, where did it start? Why did it happen? And I think only the person going through the addiction is able to identify those things. So I don't know if it's really fair for us to try to, like, figure that out. But I think we definitely tried to make reason. But yeah, I think once he was kind of going through the whole detox process, it seemed like he really hated it in the beginning. But then once he got that feeling of like being sober, and like how he was able to like live being sober, it was really cool.
Changing his mindset,
yeah, his attitude changed, which I think changed our attitude. Like, it was really cool to see him like in sober living with like a sober community, and like trying to like find a different life. And I think one of the things too that is really helpful is like when families do go to therapy after, although we haven't really done it as a family.
But we have stayed supportive, and
yeah,
I think that's
it's
all you really have to do with a family member.
I think it's finding ways and asking how they can be supported, and then find that, but then also letting them know that, like, I mean, I'm super proud of my brother and what he went through, and anyone else for that matter that I think chooses to get help and go to rehab, that's a struggle that they live with every day, and that they're choosing to stay sober. So I think it's a really cool thing that people can go to rehab and get that help.
Yeah.
And just finding a way to support your family.
And not even that, it's just like having the bold enough confidence and actually asking for help and wanting the help, because a lot of addicts do not ask for that. And he had to have an open heart and have the trust in us to actually give him that help as well. So just love on those people, and definitely listen to what they're saying, because secretly they might be asking for help and you just don't know.
Yeah.
Let's hear from a professional who has dealt with these types of patients. Let's hear from Marco.
So whenever we get patients that are showing some kind of hallucinations due to drugs, there's a couple things we have to do. First, we have to kind of evaluate how bad they are, as far as like, are they hearing voices? Are they suicidal? Are they thinking of harming others? Because the first thing we have to concern ourselves with is the staff first. If they're pretty cooperative, we try to get them to a bed, try to get them to calm down, verbally reorient them if they're having any kind of hallucinations. If not, there's a couple things we try to do. We try to just kind of give them fluids, see if it kind of helps out. If not, we can give them some medication that kind of helps relax them. Sometimes like Ativan, sometimes Benadryl. If it kind of continues to be worse, then we end up giving other medications that are stronger, such as like Haldol, Geodon. Worst case scenario, we have to put them in restraints, but all those things are just kind of how it escalates. For the most part, though, we try to reorient, and most of the time people are pretty cooperative. They're freaking out, but we try to give them fluids, start IVs, give them any kind of medications. If they're definitely in some kind of distress, like respiratory distress because of the drugs they've been using. We give medications such as Narcan. We put them on the monitors. That's another thing we do too. We do EKGs because we want to make sure that nothing cardiac related is going on. So yeah, we kind of escalate if need be. We try to cover our bases first and just ensure patient safety and staff safety.
Now let's talk about some treatment and additional support. Sabrina will explain this to us.
It is important to seek treatment when deciding to quit amphetamines because simply quitting and going through withdrawal will increase the risk of relapse dramatically. When seeking treatment, it is important for it to be tailored to the user to get the best possible results. And it is important for people to understand their behaviors and adjust them to not fall back into a relapse. When seeking treatment, it is always important to be educated in the drug to gain a better understanding of how it affects you mentally, physically, and emotionally, because most people get addicted to the drug without knowledge of what it actually does to them or how it affects them or their bodies. When going through treatment for amphetamines, there are two broad options: inpatient or outpatient care. Inpatient care allows for a person to be under 24-hour care and away from their normal environment, such as home or wherever they live. And this is ideal for someone who doesn't have a strong support system at home, or is homeless, or doesn't have anywhere to really go that is stable. And this is for people that need extra motivation to get clean. Outpatient programs allow the person to live at home, but attend programs several times a week, and this is ideal for someone who has a really strong support system at home and they have a high motivation to get clean. When receiving treatment, the patient must go through a detox period to ease off the drug. A trained physician will usually administer medications to ease withdrawal symptoms. These medications include mild stimulants such as Provigil, antidepressants, and medication for psychotic symptoms. Support groups are also available, such as peer support groups or 12-step group participation, which is one of the most popular ones when going through recovery. Therapies such as cognitive behavioral therapy and dialectical behavioral therapy are also available to help people better understand and adjust their behaviors based on triggers to the drug. Intensive therapy helps the patient learn and apply new coping skills to prepare for a long-term recovery. There is also extra support available, such as drug abuse hotlines. These can be utilized for someone who wants to get help, but they don't know where to start or who to talk to, and they don't want to ask anybody for help, like in their immediate family or friends. Or this can be someone who may be feeling like they're going to go through a relapse and they want to be talked out of it or need support to not go through it. They can also call the hotline. The main support is to have a strong and healthy environment where the temptations are minimal and you're supported by who surrounds you, such as family and friends, and you're able to actually recover and have those people motivate you. That's the most important thing when going through recovery. Here are some resources for you and your loved ones. Thanks for watching.
And a special thank you to Marco Padilla, Tatiana Cabrera, Natasha Cabrera, and Jonathan Cabrera.